welcome to the City Club of Cleveland. I'm Dan Moulthrop, Chief Executive here, and also a proud member. It's my privilege and honor today to introduce our forum, a conversation about the changes happening at the heart of Cleveland's Near West Side. It's almost impossible to count the number of forums we've had in the past 2 or 3 years where we've introduced and noted the extraordinary economic growth happening in downtown Cleveland. Amid all the growth, however, is an undercurrent of concern about whether this activity will benefit enough Clevelanders and be truly felt outside of downtown in our other neighborhoods. We see this in yesterday's City Council activity regarding a development near the Huff neighborhood. We heard it in the mayor's State of the City earlier this month when he announced the creation of a $25 million neighborhood development fund. And there seems to be widespread agreement that our ability to do this will determine our success, regardless of how many downtown projects are completed. This week here at the City Club, we heard from 2 extraordinary national figures, New Jersey's junior U.S. Senator, Democrat Cory Booker, and noted GOP strategist Karl Rove. This may surprise you, but their talks actually touched on a common theme. Both dismissed the great man theory of history and pointed out how again and again it is ordinary citizens making the right decisions based on love of country and respect and admiration for fellow citizens, that has changed the course of our lives, the course of our communities, and our nation. The men on stage today are models of this. Dr. Akram Boutros is the president and CEO of the MetroHealth System, our region's publicly funded healthcare system. And if you know one thing about Dr. Boutros, you probably know how his leadership has changed Metro since he arrived 3 years ago. Those changes are part of the content of our forum today, and he's joined in conversation by Ward 3 Councilman Joe Simperman. Joe has represented downtown and the Near West Side since 1997, and he's in his final days on the job as the community welcomes him to his new post as president of Global Cleveland. Ladies and gentlemen, members and friends of the City Club of Cleveland, please join me in welcoming 2 great friends of our Citadel free speech, Dr. Akram Boutros and Councilman Joe Simperman.
I'll start. So, Dr. Boutros, it's great to be with you here today, and we're joined by so many people that I know you would agree have been part of the reason why not only the Near West Side, but the city of Cleveland and our region is so strong. Since you've come to Metro Hospital, you have absolutely changed the way that Metro and the city and the county work together. And I would say to Ms. Contreras' point, as she introduced us and was the person who's helping sponsor this event, you've absolutely changed the dynamic within the neighborhood. Council President Kelly, Councilman Cummins, who are here, and Councilman Brackatelli and Zone, who all touch a piece of it, have talked about your leadership. And I'm wondering, what was the seminal moment for you when you realized the role that Metro could play on the Near West Side in such an outstanding way?
So I'm going to answer that in a minute. Carrie, I hope this all goes well for you, but before you get sworn in, this is where you're going to be 19 years from now. So just do it carefully. All right. And Joe, you're constantly job hopping.
Oh.
When will this stop?
9 more days.
So I would tell you it was before I accepted the job. So when I was interviewing, I ended up staying downtown. They arranged one time. They arranged for me to stay at the Renaissance, and I was taken from there to interviews. And the other time, the final time, I decided I'm going to book my own hotel. And my final interview was during the film festival, by the way. So I ended up staying across the street from the clinic, and I ended up driving back and forth. In every hospital that I've been involved in leadership or clinical position, we were a part of the community. The staff would walk around a great deal. We knew the store owners. They would come to us for discussions. We would hold forums for them and different things. And the couple times that I spent days at MetroHealth before I started, there was no one on the street from the organization. People would either bus in or drive in, and they would parachute in, and during the day nothing happened. And that's when I knew that we can actually make a significant change. I remember the first week I was walking out on West 25th, and a car pulled next to me, and one of my employees said, "Are you lost? What are you doing?" I said, "I just want to see what's around." And he said, "There's nothing around. Get back into the hospital." So that's when it really became clear, is that we really have an unbelievable opportunity here to do something great, not only for the organization, but for the people who support us. That this incredible community that we need to become more a part of.
You know, Doctor, one thing I don't think people realize is just how incredible Metro Hospital's reputation is nationally and internationally with regard to healthcare, right? We know it is our county hospital. You care for everyone, much like many of our other institutions do in our community, but you have a specific part of your mission. But one of the things that I think had to be a challenge for you is the fact that many, many people come to you who don't speak English. And I know for you, English wasn't a second language. It was barely a third language. And how do you take that personal experience with regard to the cultural diversity of where you are?
You know, it's really hard for me to recall back when we landed here in America in 1974, and I did not speak a single word of English. I spoke Arabic and French, and lo and behold, you people didn't speak either. So disappointing.
We're sorry. We're very sorry.
But I recollect how difficult it was. But time has passed so much that I'm not as sensitive to it as I should be. But that's why we have some really incredible people. We have a young lady right in front here, Mary Galinda, who set up the first program in the nation, which is a language access center in a hospital, so that any individual who has some language needs, translation needs, doesn't have to be healthcare. Any kind of language needs can come to our organization, and her staff will help them translate documents, translate the needs, help them navigate what's needed. So it's funny. Language can separate us, but when it comes to healthcare, we're truly united. Everybody who comes in, whether they speak English fluently or not, all they want is for their loved ones to get better. And you sense that. You have staff who help you translate that. We now have apps for video. We have telephones in which we have a certified translator who can talk to us. But they need, using someone's language helps them with that sense of belonging, which is really important for the healing process.
You know, you talk about the healing process. We're a city that's known for many things, our river, but also the bridges that span it. When you look at Metro's campus, from the old Brooklyn community to Brooklyn Center to Clark Metro to Stockyards to Ohio City to Tremont to the Flats, arguably to downtown, you're the common denominator on West 25th Street. And while you're still in the process of putting the final touches of the plan together, do you think there's already been changes with regard to how the development community is viewing both economic and community development opportunities on that street?
Oh my goodness! I've been here for almost 3 years, and Suzanne has been here for almost 2 years. My wife. Or if you haven't met, she's sitting next to sister. I can't believe how much changes have happened on West 25th Street in our neighborhood. And we just Suzanne and I were just touring Duck Island. Just in 6 weeks, the changes in Duck Island have been unbelievable. Our daughter just bought one of our daughters bought a house in Tremont. The other one is building a house in Tremont, and that's just taxpayers, yeah. So it's amazing to me what's changed. Now I can tell you is that we've been very, very active in getting new developments in. We're very much behind La Via Hispana, making sure it goes off well, has the support. We've recruited different housing stock within the area. We've where's Jeff Ramsey? Here he is. We've helped Jeff Ramsey is going to do a remodeling and get some tax credit to be able to do that remodeling for folks who are in our organization would be entry-level jobs. And we're working, I think I saw also Jim here. Where are you, Jim? Yeah, here, Jim Haviland. So Jim is working also on with other folks to get housing in the neighborhood. My goal, my personal goal, is to recruit 500 MetroHealth families to the neighborhoods.
Wow. While we're on the topic of numbers, Dr. Metro Hospital continues to be one of the drivers for employment. It continues to be a place where you are hiring people and people are able to live. It's also a place, though, where you are changing the dynamic of public health in the neighborhood. I'm wondering if you could talk a little bit about that, because the more people you have working for you, it feels as if the public health quotient will improve as well in terms of people's awareness of health.
Yeah, so when I first actually got here, we're talking about employment and economic growth, which, by the way, are critically important to the health of a community.
Yes.
When I first got here, the big question, I think we had a long discussion with the board, was, so what are your plans? How are you going to help MetroHealth, the MetroHealth system grow? And you keep calling us MetroHealth, and it's absolutely fine, but we're an entire health system. 97% of every person who lives in Cuyahoga County is 10 minutes away from a MetroHealth facility. 97% of the population is 10 minutes away from a MetroHealth facility. So that's something we've done over the past 3 years, is the significant expansion. Because, frankly, we're not a West Side health system. We may be a West Side hospital, but we belong to Cuyahoga County. So the discussion with the board was, what are you going to do? And the answer was fairly simple, is I've never seen anybody cut their way to long-term success. The only thing I've ever seen is that you can grow your way to long-term success. So we were going to do things to make sure services are accessible to everybody in the county. Now, first year I was here, when Dan invited me to speak, I got people a little bit uncomfortable when I talked about healthcare outcomes in Cuyahoga County, that we were 67th out of 88 counties in Ohio for health outcomes. Okay? Now, I'm really happy to tell you in 2016, which the numbers just came out, we're 64th. So we made some steady progress. When you look at clinical care, okay, how accessible is clinical care for the people of Cuyahoga County? We're now 5th. Okay, so it's not about clinical care. It's not about how good the doctors or the hospitals are in this area, or how many of them there are. I mean, you probably couldn't walk down a street and not trip over a provider. Okay? There'll be a UH, a Cleveland Clinic, or a MetroHealth, or a Sister of Charities provider. You're going to run into one of them. So we have plenty of access. We have plenty of expertise. We have plenty of technology. What's gotten worse, I mean, by the way, we could have gone from 67th to, honestly, in the 50s. But what's gotten worse in Cleveland are two things. Our physical environment went from 36th to 61st. Okay? We have, talking about the west side, if we do not tackle this, the health outcomes in this community is not going to change. The second one is health behavior has gone from the 15th to 39th. So, and what is health behavior that is terrible? So smoking really hasn't changed.
Right.
Okay, that's not how we got worse. It's walkability, it's exercise, and it's nutritious foods. So we didn't deal with the food deserts. We still have crumbling infrastructure, and also, by the way, the air quality for Cleveland has gotten worse over the past few years compared to other areas, other counties. For Cuyahoga County compared to other counties. So, MetroHealth has a responsibility. We do not have enough money as a country to be able to fix healthcare issues after they have occurred. We've been doing this for the past 50 years, and this is it, folks. We have increased life expectancy as much as humanly possible with technology. We're now dipping. Health habits are creating, our children are not going to live as long as we do. Okay? So there isn't enough dollars to be able to fix this. So the only way to be able to fix this is actually deal with the social determinants of health. Social determinants of health happen to account for over 60% of health outcomes. Clinical care is 20%. So it's a lot cheaper to tackle the social determinants of healthcare, and it gives you much better long-term results.
You know, Doctor, as the head of the hospital and the health system, I remember when you were up here and you talked about one of your goals being the eradication of C. diff and changing that whole protocol. Everything from that to your leadership, along with Mayor Jackson and Council President Kelly, on how does Cleveland change its role with regard to African American infant mortality. From seemingly simple things to dealing with the health disparities, how does that affect your view now that you've been at Metro for a while, and how does that affect the neighborhoods around you? Because clearly there's a connection between public health and economic and social development.
They're so tied together, but sometimes it's hard to really convince people of that, because people will support you when you need to provide services to a child who is asthmatic and is having a terrible problem breathing and needs to be in the hospital to receive the care. But if you start talking about how do we have clean air, that connection doesn't easily follow. What I can tell you, what I've seen in Cleveland is that since I've been here, this region is unbelievably generous. Not just in dollars, but in spirit. People want to do the right thing. But I've also seen that people want to do the easy thing. Okay? People want to do something and have an immediate outcome. And we've tackled a lot of these things already. I think we're going to now have to do the hard things. We're going to do the hard things of actually having to collaborate and not fight over territory. We're going to have to do the right thing by saying is that your interest overlaps with my interest about 70% of the time. We're going to ignore the 30% that they're not going to overlap. So we really need to go beyond the superficial here, and we need to be able to look at this as a mutual responsibility. One of the things I will tell you is that we did not get here overnight, and we didn't get here because of one thing. You and me and everybody who's been in this region for a long time is culpable for the results we have today. And it is our responsibility to fix it. We partially made it this way. Whatever actions we've done or not done has resulted in this. So we got to fix it. And the way to fix it is not to do the same thing over and over again. The way to fix it is to completely think outside the box and begin looking at things that people have not tackled before. So education, we've begun a program in which we have 75 children. They're MetroHealth scholars who come from 2 local schools who are being exposed to health careers and are gaining responsibilities and a way of looking at things that is going to help them in the future. Compare an inner city child who is poor and compare a suburban child whose family is doing well. You ask the 12-year-old, what do you want to be? The inner city, they tell you, I want to be a doctor. You ask the same child from the suburbs, and they tell you that I want to be neurosurgeon. And that may, at face value, seem like they're saying the same thing. For one, it's a fantasy. They see just this euphemistic doctor thing. For the suburban child, they know several doctors. They know the dermatologist, an internist, a neurosurgeon, a cardiologist, and they get to pick which one of them. They know much more about their future and what the possibilities are than the child from the inner city. So we're actually exposing them to all these jobs. We're showing them that there are master carpenters who are making over $100,000 a year. That you can become, and again, I remember this young man who started with us, and I said, what do you want to be? He said, I want to be a doctor, and now he's telling me he wants to be a vascular surgeon. That's the change.
You know, Doctor, a lot of things I think people admire about you is that you model the behavior that you tell other people should model. One of the words you used earlier in your answer was collaboration. And there has been a lot of conversation in our community over the last year about collaborating with trauma. And there's models right there between UH, Sisters of Charity St. Vincent, Cleveland Clinic, and Metro. And it's an amazing fact that Cleveland is one place that really leads the nation in that, and that happened because of teamwork. If you could talk about that a little bit. Well,
we're working it through, but one of the things we decided to do is hospitals sometimes, individual organizations get overburdened with demand for beds. And what we've decided to do is that not to have the EMS staff and the patients pay the price for that, by going on diversion and saying we're not going to take a patient, we've decided as a group that we would work with one another so that we would never go on diversion again. And I think as of February 1st, I don't think any of us have gone on diversion.
Wow.
So,
congratulations.
So I want to tell you what you asked, what it's going to take also for us to do this, and I just pulled this out, and I just want to please forgive me for some of you are going to find this just a little peculiar, but I listened to Cory Booker this week, and I was also very moved. But it's going to take great leadership, okay, for us, not just good leadership, not regular leadership. It's going to take great leadership for us to achieve what we wanted to achieve. So I wanted to define to you what great leadership is, and I think you'll quickly see what I'm talking about. So great leadership is patient, it's kind. Great leadership does not envy, it does not boast, it is not proud, it does not dishonor others, it's not self-seeking, and it is not easily angered. Great leadership keeps no records of wrongs, does not delight in evil, but rejoices in the truth. And great leadership always protects, always trusts, always hopes, and always perseveres. So what I think great leadership that we need in our community is love. So we need to love one another in a way that closes the gap, builds the bridges, so that we don't talk about them and us. So for me, there's no separation between the Sisters of Charity, Cleveland Clinic, UH, and MetroHealth. Despite our differences, the executives' differences, I can tell you, but she knows this already, I can tell you I love Sister Judith Ann, I love Tom Zenti, and I love Toby Cosgrove. Okay? They are doing good things for our community. We may approach it differently, and we may have sometimes our disagreements, but we need to stop from demonizing what other people are trying to do. I think we just need to love one another and just do a better job of it.
Doctor, thank you for that. You know, you come from a different region. You were born and raised in the New York community.
Where there is no love.
And
we will scratch your eyes out. There is no love.
Here on the last Friday of March. Some observations that you have as we start getting into the questions and answers about things that Clevelanders don't know both about their own city, about the region that you've observed since you and your wonderful family have moved here. You know, they often say that a prophet is never accepted in their own home. Well, you're a prophet, obviously, in a home other than the one that you were born into. Just any insight that you have. You've hit on some very spiritual topics these days.
I am definitely not a prophet in my own home. I have 3 daughters. You know, it is, we have such an incredible history in this town. Some people want to cling to it. Others want to forget it and move forward. But I think you need to do both. It is such a, I mean, Suzanne and I, when we began driving around here, just looked at the architecture and said, oh my God, I can't believe so much is still here. It's just absolutely amazing. And then you have all this building growth that's going around. We need to both honor the past and look towards the future. Kate, isn't that the name of our gala? Unveil the future, sorry. So we need to both honestly honor the past and look towards the future of the development. I will tell you, the number of young people who are moving into Cleveland, the number of young people who are from Cleveland, from Cuyahoga County, who are staying here, gives me so much hope. Whatever we've gotten wrong, they're definitely going to get right. So they are really the folks who are going to take us forward. We just got to lay enough of a foundation for them to be able to do better.
And finally, Doctor, in 5 years, somebody comes off the freeway to get world-class health care at 2500 MetroHealth Drive. They pull up and they see what? What does the corner of West 25th and MetroHealth Drive look like? What does it communicate to the surrounding neighbors?
So I'm hoping less and less people actually are going to be coming to an inpatient hospital. So our aim is to reduce the number of hospital beds. You know, frankly, with the opening of, when we take over completely Cleveland Heights, Parma, and the opening up of Brecksville, we will be introducing this community to the first bedless hospitals. So that means one of these facilities will have everything you need that you would normally get from a hospital except inpatient beds. Wow. Literally everything you need. That's what we need to move towards. We need to move towards the fact of that keeping you healthy is the goal, not having you come as an inpatient. So it's going to be a smaller facility in the number of beds, but what you will see it will be completely dedicated to the patients. So when you get to the hospital, administration is not going to be there. Other services are not going to be there. This hospital is being designed by patients and their families. So, for example, we are designing it with this concept of on-stage, off-stage. On-stage is where we take care of patients and where their families are interacting. Off stage is how we are filling the supplies and everything else. These two areas don't ever meet. You will never see transport happening in this new hospital. It will all be happening behind the core, in which the patients actually don't ever get to. So very much like a hotel, you don't see people wheeling things through. Very similar concept that we'll be doing. And I have to tell you, it was amazing for me. When we were designing the ICU beds and the critical care pavilion, we started with patient groups, family groups, nurses, doctors, all sorts of specialists, and we met with them individually. And then we tried to get all the input and put it in one design. Well, nearly impossible to do, and every time we tried to compromise, somebody would get upset. So we decided, all right, we're going to start all over again. We actually built a mock room, put every one of these people in the same room together, and let them hash it out. The amount of compromises when a patient actually tells the doctor, no, you don't know how this feels being horizontal and you doing this while you're vertical. Because we had very different perspective. While they compromised, they ended up very quickly coming out on a design, and the changes from that design from what we originally had were absolutely remarkable. But they all came together to do what's best for the patients.
I hope we can use that model in July in Cleveland. Dan? You like how I got that one off?
That's great.
Right?
That was perfect. That was amazing.
Thank you.
What's happening in July?
This does feel like the exact right way to be heading into a holiday weekend with, surrounded by friends, our speaker quoting scripture. We're all good. Today we are enjoying a Friday forum featuring Dr. Akram Boutros, President and CEO of the MetroHealth System, and Councilman Joe Simperman, who represents Ward 3 in Cleveland. And we're about to head into the Q&A. We welcome questions from everyone, City Club members, guests, and students, and those of you joining us via our radio broadcast or our webcast or our new live simulcast at the Parma Snow branch of the Cuyahoga County Public Library. If you would like to tweet a question, and you are encouraged to do so, even if you're in this room and you don't feel like getting all afraid of the mic, you can tweet the question at the City Club, and our staff will try to work it into the program. We encourage you to make sure your questions are brief and to the point, and in fact, questions. Holding our microphones today are Content Associate Teddy Eisenberg and our Director of Programming, Stephanie Jansky. May we have the first question, please?
Good afternoon. First of all, let me just praise Metro in your partnership with Lincoln West High School. I actually heard students talk about how they were able to find out that there's more jobs in the hospital besides a doctor and nurse. So that spoke to exactly what you said. But my question deals with our serious infant mortality rate. So many times when people are poor, they can't get to the hospital to get the kind of help they need. So my question is, what is MetroHealth doing to address the serious infant mortality rate, especially with parents who are poor and can't always make it to the hospital?
So that's a great example of collaboration. So Kevin Kelly, Mayor Jackson, and Cuyahoga County Executive Armand Budish came together and asked all the health systems to work on this initiative of First Year Cleveland. There are three major causes of infant mortality. And infant mortality, by the way, is defined as death during the second or third trimester and also in the first year of life. So there are three major causes: prematurity, malformation, so all kind of genetic things, and sleep disorders. So sleep problems. So for Cleveland, if you actually looked at the data for Cleveland, we don't have a lot of problems with malformations, and we actually have less than the national average on sleep death, like SIDS. So most of our issue is prematurity. Okay, so what's important is to be able to get healthcare to these patients. So we've had several different programs that we've tested that actually worked very well. Rainbow Children's Hospital has an incredible program for centering that has also worked very well. We've come together and we've said we're going to expand these programs to each other, and we're actually going to work with each other to do that. We also are introducing, and thanks to the Mount Sinai Foundation, St. Luke's Foundations, and others, we are doing a program called Nurse Family Partnership, in which a nurse goes into the home, helps a new expectant mother with the health care preparing for the child. We've asked actually the Medicaid director for $5 million a year as a group for the next 2 years to expand these programs, and hopefully we'll be hearing a positive response from them. The biggest issue that we need to tackle is community support. In some communities, and I said this at the inaugural meeting, in some communities, it has become a daily fact of life that someone either has experienced, that every woman of childbearing age has either experienced or knows someone who's experienced the loss of a child, having infant mortality. That's just become commonplace. We really need to make it as appalling as most of us think it is. Okay, so that means we're not going to wait in the hospital and wait for you to come in to get care. We're going to have to love you enough to get into the worst neighborhoods and support you enough so that we make sure that your baby is as healthy as possible. And that's what the First Year Cleveland initiative is all about.
I am moved by your interest in the social determinants of health, and it seems to me as you try to find access to people's thinking about their own behavior and how it contributes to their health, you are led into some tricky terrain. Particularly if you respect diversity, you need to have a very diverse and ethnically appropriate means of reaching people.
Sure.
How much does ethnically targeted efforts on the part of MetroHealth System take you into difficult questions of addressing different communities, different languages, and I suspect you're as well positioned as anybody in the city to comment on how you do that.
So I'll give you an example. The diabetes rate in Hispanics is very high. The mortality rate from diabetes in Hispanic males is the highest of every other subgroup. So we have an initiative to actually teach healthy Hispanic cooking. Okay? Now, I eat, I don't cook. So just I'm not the guy to help you do that, but we have actually experts and chefs who can help have tasty, authentic, ethnic food that is going to help the individuals stay healthy. But I will tell you, so you want to talk about tricky, the machismo Latino male cares about taking care of their family. That is their biggest and most important thing. So you're also not going to tell me what to eat. So we have to change the discussion around that with, if you really do care about your family, you're going to be there for them longer. And we need to have these discussions around that. So I guess I'm saying things that people don't normally say, but it's the truth. So we got to figure out how to also change the dialogue and say, if you really do care about your family, you will take care of your diabetes. You will be here there longer for them. And have that, so I can tell you that I've never met, when I used to practice and I used to talk to Latino gentlemen, I used to always ask, when I wanted to get them motivated and they had young daughters, I would always ask them, do you want to go to their wedding? And if they said yes, I said, okay, there are some things you're going to have to do. But if you don't want to go to their wedding, yeah, just keep going what you're doing. The likelihood is that you may not be there. So, but if you want to do that, this is what you need to do. So you have to find out what motivates them as well to be able to move them to that direction.
Doctor, in the last couple of years particularly, we've heard a great deal about the failure of our government to provide adequate means to treat veterans, particularly from Afghanistan and Iraq, but also veterans going back to World War II. In your remarks, you indicated some considerable cooperation among the major hospitals in this town, but I didn't hear anything about cooperation and coordination with the Veterans Administration Hospital, the Stokes Hospital, and Wade Park. Can you give us any hope that there is, in fact, some efforts being made to see that a veteran from Brecksville does not have to find his way 30, 40 miles across the county, much less veterans from surrounding counties, to get to the VA hospital to get adequate treatment?
So I can tell you that we do have some collaboration. All of these collaborations are determined by what the VA will permit them to do. So we're interested. We'd love to continue doing more of them. Here's where my perspective as the CEO of the MetroHealth System on veterans. You can walk into any MetroHealth facility, we'll take care of you. Doesn't matter what the insurance is, whether you have coverage or you don't have coverage. We owe every person in Cuyahoga County, especially the veterans who have put their lives on the line for us, the access to the best quality care. And if you think that's us, come on in, love to have you, we'll take care of you. As if you had the best insurance in the world. Now, a friend of mine just became the undersecretary of the VA. I can tell you is that my hope, based on my conversations with him, is he's going to look at letting veterans receive the services that would be much better provided to them closer to home through collaboration. I don't know how long that's going to take, but I do have hope that he's thinking about it the right way.
Doctor, you said earlier in your statement, you said one child from one part of town may say I want to be a doctor, the other may say I want to be a neurosurgeon. Everyone in this room has a journey story and an origin story. What was the moment when you said, I'm going to be Dr. Akram Boutros?
Oh my God, there were so many moments I said, I'm not going to be Dr. Akram. So both my brothers, I'm the youngest of three boys, and both my brothers are also physicians, much smarter, honest to goodness, much and more accomplished than I am. But we all were influenced by my mom's cousin. And this is what happens when you're a kid, right? We met this unbelievably great man, and he was a physician. And we assumed he was a great person because he was a physician. Turns out that he's just a great person and also a physician. So that's what we assumed he was. So we all wanted to emulate him, and we all decided to do that. I had many forks in the road. I applied to college, and I also applied to Parsons School of Design and was accepted there. So I had to choose between those. Really impress you? I interned at Mad Magazine. Okay. So they talked me out of becoming a cartoonist. So this, but for me, I had to decide between these two. So I honestly, frankly, I said, all right, I'm going to pursue sciences, and if I don't like it, I can always do design. When I was graduating college, I got accepted to. I applied like everybody else applied to medical school. I was very fortunate. I got in very early, and I got to almost every medical school that I got accepted to. But I was actually being also recruited for chemical engineering and nuclear engineering. And I thought this was the coolest thing. You're gonna let me play with nuclear stuff? But this is gonna sound silly, but I felt guilty that so many of my friends had not gotten into school, and I got into school really easily, and I said, all right, I'm gonna go give it a shot, see how it goes, and see if I don't like it, then I can pursue the other career. And then in the middle of my medical school, my family's business began to fail. My family's business was jewelry. That's why my wife decided to marry me. It wasn't my good looks. But I took time off and became the president of that company, and ran that company in the middle of between my second and third year of medical school. And the company really did very well, and I had to make another choice, which is, should I just stick with the company, do that? You made money a lot easier in jewelry, and less late nights than in medicine. So, but I decided to do that. But I will tell you this, I am meant to do this. This is where I'm meant to do it. I've always done good in the jobs I've had. I've never known what a life's calling is till I got to MetroHealth. This is what I'm meant to do. I'm not leaving unless you run me out of town, or I'm dead. So I'm staying here to do this because this is truly my family fulfills a very large part of my life. This is now completes it.
Turning a little bit back to development, we have a question from Twitter. Tracy would like to know why MetroHealth is investing more in the suburbs rather than the city, and why this appears to be a general trend amongst hospitals in the Cleveland area.
Yeah, honestly, I can't tell you about other hospitals. We're not building hospitals. We're building outpatient facilities. And we always had this idea of the bedless hospitals, and Brecksville was going to be the first one, because we had a lot of patients who would travel up to MetroHealth, and we thought it was just a very, very long trip for them to do that. So we decided to do this bedless hospital. And when the opportunity came with HealthSpan, we said, you know what, this makes it now right. So we're going to do these 3 facilities, be able to reduce the size of our hospital, keep bedless hospitals. And just, you need to remember, we're a county-focused institution, okay? The people every person in Cuyahoga County pays taxes that end up support MetroHealth. Now, it's a lot less than it used to be. I was looking at data from when Henry Manning was the CEO. About 50% of the revenues used to come from taxpayer funding. This year, it'll be less than 3%. Wow. Okay. $1 billion health system, and $32.4 million will be coming from taxpayer support. The rest of it is coming from us. One of the other things you should know is that if you actually looked at the last year we received $40 million. The $40 million we received, we put back in care, unfunded care, $184 million. So we took the $40 million, added $144 million that we made from profits in other places, and put it back into the community. So frankly, if we can't make the $144 million, we're not putting it in. So the more money we can make is the more money we can invest in the community. My board has set our compensation targets, irrespective of how well the hospital ever does. I could never be paid more than they set these targets, and we've all agreed to it. Okay, so if we make lots and lots of money, our only place to put it is back in the communities.
And on that point, what role did the fact that this was one of the states that allowed for Medicaid expansion to occur have an effect on West 25th and MetroHealth Drive? We're joined today by John Corlett, who worked with you, doctor, who led the Medicaid effort in Ohio when he worked for a previous administration. But you're on the ground, you're in the emergency room, you're in the rehab center. What was the net effect of that effort?
From MetroHealth's standpoint, it turned out to be and that's what a lot of people ask me about, what the financial impact of Medicaid expansion has been. If you looked at the complete net effect of Medicaid expansion at MetroHealth, you have to look at what the reductions in reimbursements have been over at the same amount of time. And I have to tell you, the bottom line impact is negligible, okay? When you look at it from meeting our mission, yes, it is one of the greatest impact you can ever see. We got folks who have been completely not being provided any care, who just would wait until they got sick and ready for the ICU for them to come in. From a mission perspective, it has been the greatest boost I have seen in my lifetime for an organization. From a financial... So I had a board member say to me, so you mean we're doing a lot more work for no monetary gain? I said, yeah, but it's good for our soul.
Going back to the near west side for a minute, what would you like to see, Dr. Boutros, when you walk out the front door of your near west facility, possibly with Joe Simperman's help, by also recognizing that there are resources in the community and there are residents who live already in that community. So without displacing them, what would you like to see? How would you like to see that picture?
So I want to, and I'd like to recognize Ms. Maureen D., who is on our board of directors. So Maureen, I'd like to see a walkable neighborhood, a very diverse walkable neighborhood. One of the pledges I've made, and I think it was both to Joe and Brian, was that MetroHealth will never, ever purchase an occupied home. We're just not going to do it. It is not our intent to displace anybody from the neighborhood. We actually think the neighborhood, the people who are in the neighborhood are the fabric of the neighborhood. We want more people to come into the neighborhood. We don't want to displace anybody. So I want to see small stores that are opening and thriving, owned by folks from the neighborhood. I want to see restaurants. I want to see houses of worship that are actually have lots of people in it. We had 2 churches close literally now on the MetroHealth property because we own that piece of land. I want to see people not coming to MetroHealth for healthcare, but actually for their fitness, for health activities. We want to build a park-like environment so that people can enjoy that. Through a program that we're doing, the Arts in Medicine, we want to be able to bring the arts that are available in University Circle to be more accessible to people on the near west side. You want to see a vibrancy that I saw in the Village in New York City. Community that actually would be so diverse, had new immigrants in it, had very well established folks, lots and lots of stores, small stores, and lots of activities during the weekend. One of the things I really that depresses me is when I drive to MetroHealth during the weekend. There's almost nothing going on on the streets. When our employees are not in full force there, it's a ghost town.
Doctor, we just got a text, and the question was this. There's some conversation I didn't realize about people talk about politics being local and medical care is personal. What was the most personal moment you had as a patient, not as a doctor?
Well, some of you may know I'm a trauma survivor, and at the age of 15, I was so disenfranchised. I joke about not being able to speak the language, but I was I didn't feel welcome. I didn't feel a part of America, and I started hanging out with the wrong people. And I was about to have a gang initiation, and then I got the luckiest break in my life. I was hit by a truck, and I ended up in the hospital for a very long time, 11 surgeries. They didn't know I was if I was ever going to walk again, and so my moment was that I had a gentleman. They didn't have enough pediatric beds, so I was put on an adult unit. There was a gentleman who was talking to me, who ended up dying that night in the next bed. But he was telling me to stop feeling sorry for myself. I was really upset because not only were both my legs broken and shattered, but that my friends, nobody came to see me. Only my mom and dad were there, but none of my friends had come and see me. And he told me to stop feeling sorry for myself. He said, life is full of choices. You can decide to do good or to do bad, to be successful or unsuccessful, to make a difference and to give or to take. So he said, so that's up to you. And you're a young man, you're going to have a long life, and you should, decide to make your own path, decide to do the right thing. So that is the clearest moment for me, that life-changing moment in healthcare. I would have never listened to this gentleman had I not hit by a truck. I would have thought of him, another old guy, what does he know? I'm 15 years old, I know everything there is. That vulnerability helped me to listen to him in a way that got me started on where I am today.
You're a beautiful man.
Joe said I'm a beautiful man, and we do have an ophthalmologist in the
I was going to add that, Joe, you're not too bad yourself. Today at the City Club, we've been enjoying a Friday Forum featuring Dr. Akram Boutros, President and CEO of
MetroHealth,
and Councilman Joe Simperman of Ward 3 for 9 more days. Special thanks to today's table sponsors, Cleveland City Council, Cleveland Clinic, Cleveland Neighborhood Progress, and Enterprise Community Partners, Forest City Global Cleveland, the Center for Community Solutions, and the MetroHealth System. Our community partner for today's forum is the Hispanic Alliance. We thank all of you for your support. Thank you, Doctor and Councilman. Thank you, ladies and gentlemen. Our forum is adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.